Hello, everyone. Thank you for your patience, and sorry we're running a few minutes late, but we're set and ready to go with our next session. For those of you who are just joining us online or in our audience room here at VCU, welcome to the Center for Media and Health's Research Symposium. And this panel is a professional panel. We're talking to some folks on Ebola and social media. I know that our keynote speaker, Brian Ellis, spoke a little bit about that, but we're going to continue the conversation because it's a really hot topic right now. So each presenter is going to have about 10 minutes to speak, kind of give an overview on their experiences with Ebola and social media, and then we're going to open the floor to some questions. For those of you who are joining us online or would like to tweet with us, use our hashtag VCU Global Health. And also for those of you who have not followed us on Twitter, our Twitter handle is VCUCMH. Also, I forgot to introduce myself. My name is Dr. Rowena Briones. I am here at the Robertson School of Media and Culture, and I'm going to turn it over to my co-moderator, Jeanine Guidry, to introduce our panel and get this all started. So,
hi everyone, I'm Jeanine Guidry. I'm a doctoral student here at VCU, and we want to get started with the first speaker, Daniel Molokele. He is with AIDS Accountability International. Daniel, over to you.
You just unmute your mic, yeah. There you go.
Hi everyone. Greetings from Johannesburg in South Africa. Am I clear?
Yes.
Okay. It's a very wonderful platform to be invited to and also to share our own experiences, especially on behalf of civil society in Africa. I've been working with civil society since August last year, where we, as AIDS Accountability International, were worried or anxious to know what civil society was doing in terms of the response, especially a coordinated response to the Ebola epidemic in West Africa. So AIDS Accountability International from South Africa, we managed to use our database to invite different organizations across Africa to discuss a plan to work together as civil society and support the response. One of the obvious things that we did was to call for a teleconference in which we invited different organizations to send representatives into that conversation. And we managed in September to host that international telecon, and one or two key outcomes came out of that meeting. The first one was that we agreed to set up a mailing list, a list safe, so it exists at the moment. It is an open platform with about 150 different email addresses, and the participants are mostly program managers and coordinators and directors of different civil society organizations across Africa from about 20 to 30 different countries. I need to double check, but between 20 to 30 different countries. We have civil society leaders from Liberia, from Sierra Leone. We are struggling at the moment to connect with leaders from Guinea, which is one of the countries affected by the epidemic. But we do have other neighboring countries such as Nigeria well represented in the platform. The other thing that we agreed to do that we are still working on was to set up a database of civil society that are willing to be part of a programmatic response, and they filled up a template. At the moment, there are about 20-something different organizations across Africa, even in countries where the epidemic has not yet reached sort of unaffected countries like here in Southern Africa, Central Africa, Eastern Africa. We have civil society that is given contact details, such as a contact person, email address, telephone, website details, and they've filled up a form to say, this is our area of strength, this is our area of specialty, so we can help, whether it's organizing volunteers, whether it's doing a social media response, whether it's doing a public awareness campaign, lobbying of political leaders, of business people, stakeholder alignment, all those kind of different value adds. So we have the database, and it's a live document. We still continue to add new organizations. And last month, I managed to travel to Addis Ababa in Ethiopia for the African Union Summit, where they were launching the Ebola Foundation, the Ebola Fund, and also the African Union Foundation. So we are trying now to work with the African Union Foundation together with the Ebola Fund and other stakeholders in that setup, working also with Oxfam International, with other organizations such as One, to ensure that they plug into the civil society space that we are in. So at the moment, we're also trying to use other platforms that we can use, including accessing social media such as Facebook, such as Twitter, and LinkedIn, and so on. So we're beginning to gel, because the real point is that we need to have a sustainable platform, and social media is one easier way to ensure that we continue to engage. Those in South Africa, we are also considering using WhatsApp application. So a group discussion using WhatsApp and so on. So I think in 2015, we will see this platform growing. And not only that, we are actually thinking that in July, South Africa will be hosting the African Union Summit. And we want to host an international conference for civil society and the Ebola response. And also, we want to explore the possibility of saying, instead of just responding to Ebola, we need to respond to other epidemics in Africa as a civil society platform, and working with the African Union Commission and other development partners and head of states and governments. So this is something that we're working on, and we believe that because social media makes it easier for all of us to relate with one another, much more cheaper, this is the direction that we're encouraging each other. So at the moment, this is where we are as civil society in Africa, and we're encouraging anyone to join this platform, even if you are not an African, but if you're a friend of Africa, even if you are in America, you are allowed to join this platform. And if you can link us up with any friends of Africa to support us as civil society, it's still welcome. So the mailing list, the listserv, so to speak, is a public facility for mostly for civil society or NGOs or activists. I'll stop here for now. Thank you.
Awesome. Thank you. Thank you so much. We're going to have time for questions in a little bit, but I want to turn it over now to Dr. Margaret Scarlet. She is a consultant, has worked with the CDC, and is still working as a consultant for the Centers for Disease Control. Dr. Scarlet, if you can unmute your microphone.
Hello. How are you doing today? Can you see me?
Absolutely, we can see you. So glad you can join us.
Great. You know, I think our prior speaker talked about the issue of civil society and how important that is. And social media has been very, very important when in this Ebola outbreak, because the normal ways of communicating have been impacted by fear and other things. So what I want to talk about is that there are three major points for now. Preparedness for Ebola is part of global security, and containing Ebola in Africa is essential to containing Ebola in the U.S. And we've learned that communication is critical, and just like other core public health interventions, like care and treatment of persons with Ebola, personal protective equipment, identification of patients with Ebola and suspected Ebola, and contact tracing, communication is just as important and is part of what it is that we need to do. Last week in a Reuters article, Doctors Without Borders reported that there was a lack of public health messages in addressing Ebola was a big mistake. We learned in this outbreak how important building trust and communication is from this outbreak situation. And I know that CDC produced radio messages in different languages, which is fantastic. And there were other organizations that produced fantastic messages. And this is a good thing. But there might have been insufficient reinforcement and trust building with communities. So I think hearing the voices of individuals like our first speaker is terrific, because we've seen breakdowns in civil society because of this outbreak, and we have to be prepared for future issues. So the main messages that came out were avoiding close contact with sick people and their body fluids, identifying and isolating sick people, and ensuring safe burial. And I want to just talk about Ebola in the context of before and after. Before the Ebola outbreak that we've seen that was really at its height back in October, we saw this as Ebola as some exotic tropical disease that it really didn't impact us at all. I think now we are realizing after that responding to Ebola and other infectious diseases is part of our global health security. I think this is a very, very key message. We've succeeded as a collaborative action across global organizations in slowing the epidemic with a worldwide response, but it's not over. So I want to say it's been serious, but it's not over. There were over 100 cases in January and a new outbreak in Guinea from burial practices. The World Health Organization put out a new report on Ebola that there were 3 countries, mainly Guinea, Sierra Leone, and Liberia, who had 22,000 plus cases of Ebola confirmed with laboratory tests and more than 9,000 deaths. This is tragic. But what makes Ebola so scary is that it has a very high fatality rate, about 50%, but it is relatively rare. I think our prior speaker talked about the fact that we do need to be prepared for, other events and other situations. And if I can switch to this slide, I think let's see if it works. Are we on now? Yeah, so the way that we've been thinking about this, can you see the slide?
Yes, slide. Yes, I can see the slide.
Great, thank you. So we have to think about the way in which we're responding to Ebola as firefighting. That the main fire was in Liberia, Sierra Leone, and Guinea, and we worked collaboratively with different organizations across the world to contain the epidemic. And there was the main fire that's been burning that's now gradually much smaller. But there were other wildfires that were occurring in Nigeria, in Senegal, in Mali, and other countries. And what it's done for us is to ensure that we're really increasing preparedness of all the other countries, as our first speaker talked about. And this is one of the nicer communication messages about Ebola and response for incident management, treatment, burial support, ensuring infection control in all health systems, as well as communications. And I think that, again, you see communications, social media is a part of communications, and it's one of the 5 components of an effective Ebola response. I really want to emphasize that. So it is important. It's one of these 5 pillars, if you will, of an effective Ebola response. This shows that Ebola is not just part of our connection to each other, but it's part of a health threat connection. This is a slide showing the air travel across the world, and you can see the number of air bridges, if you want to call it that, that's showcased here in our global aviation network. One of the key messages that I'd like to leave you with, too, is that global health security requires 3 major ways in which to respond. First is to prevent by promoting infection control and safe burial for Ebola, as well as ensuring that there's proper training on infection control for healthcare workers and individuals understand the importance of safe burial practices. And then detecting these first cases, improving disease and syndromic reporting, and making sure that as we learn from preventing and detecting, we can respond appropriately from our experiences with appropriate action. And I just want to say that one of the important issues is that Ebola is a tragic and infectious diseases, but infectious diseases have been around for a while, and we have to learn to live with them. You'll see on the right that this is a 1600s Venice costume used for the bubonic plague, which was full body coverage with a mask for the face that covered the nose and mouth. And linen was covered in black wax to prevent contact with body fluids. The gloves and beak were used to examine patients. On the left is the newest system from Johns Hopkins with an easy rear closure suit and desiccation system for assuring dryness. And it allows patients to see the face of the person treating them, which has also been a major issue. Ebola, hopefully we'll see more of this soon in the future, which is only a prototype. But Ebola is a rare disease, and there's much to work on with at least 3 vaccine candidates, but currently there's no treatment for Ebola. We're learning a lot right now from the experiences of last year, and hopefully there will be some in the future. But I also want to put this in perspective, not only in the United States, but across the world, that there are many much more common diseases like measles, which were eliminated in the U.S. in 2000, which was a great success. But then we've seen over 600 cases of measles in the last year, including 100 cases or more from this latest outbreak of measles at Disneyland. So this could have been prevented through measles vaccination, which has saved over 700,000 lives and 2.5 million lives in the U.S. alone. And around the world, it's much more. So infectious diseases are here to stay, and that's why we must be prepared. So I want to say that that we live in a world where we're all connected by the air we breathe and the water we drink, the food we eat, and by airplanes that can bring disease from anywhere to anywhere in a day. We can fear or we can care. And I think this is an important message. It's a message that can be communicated through social media quite nicely, and to understand how we can work together.
Thank you, Dr. Scarlett. I'm going to turn it over to Dr. Jay Achar. He has been for the past months in Sierra Leone with Doctors Without Borders, actually working in a clinic, and he has been tweeting from the field. We are going to list those link to his Twitter profile. I've been following it. I recommend you do as well. Dr. Jay, go for it. Can you unmute yourself?
Yeah, sorry.
There we go.
Hello, can you hear me?
Yes.
Okay. Okay, so maybe I'll give a quick background to what my experience is this last 6 months. So I'm an infectious diseases doctor who has been working for MSF for the past year, and initially went to Sierra Leone to work in one of our big treatment centres in late August, early September last year. And so worked as a doctor with patients during a period when our treatment centre was very, very busy. We're receiving many patients every day, up to 15 to 20 patients a day, and I was providing them with clinical care. And then after that, I've remained involved in the Ebola response from MSF's point of view. I've got a job in the headquarters in the London office, providing field backup and visiting the projects on a regular basis. So I've just got back to London from Sierra Leone around 10 days ago, and it's been very interesting. Each visit to our project has been very different. Each month, I think we've been surprised at how quickly the outbreak has changed in geographical areas, but also with so many different nuances in the way that transmission has occurred, and people's perceptions to the disease have certainly changed in Western countries as well as in the countries affected. I think at the moment the general feeling, I think in Western countries, is that transmission has reduced significantly, which I think is true. But equally, I think it's also important to remember that this outbreak developed after one case, and that each day there are still more than 10 cases in Sierra Leone alone, and so there's a need to remain vigilant for these cases. Part of that is obviously social mobilisation. Our organisation has quite extensive networks in the country around the projects that we support to ensure that people in that locality, in that district, understand the disease and understand the concept of why we're there and what the treatment we're offering aims to do. And so there's a huge amount of information given out to people in the countries that are truly affected. So my efforts with social media are obviously quite amateur. I've got a Twitter account and was tweeting a little bit while I was in the field in September to really highlight some of the things that people weren't seeing in the news and people didn't maybe understand. Before I went to Sierra Leone, I was asked to participate in a short television interview in the UK on breakfast news, and most of the questions actually related to some of the uncertainties in the UK around what Ebola was, whether we were at risk in the UK, why was I going, isn't it just too dangerous, and all these sorts of things that we take for granted now 6 months on, but if you think back to August and July of last year, everyone was scared and worried, and rightly so. But equally, we've had a lot of information in Western countries that have kind of explained the situation. And so for me, part of that was tweeting and using my Facebook account and these sorts of things to show pictures of what we're doing, why we're doing it, to highlight that people in Sierra Leone who were afflicted by the disease were live a very similar life to how we would lead them in the UK, and to really make the issue more personal. Interestingly, I think as time has gone on, people have started communicating with me a little bit more on social media, asking me questions about what I've been seeing while I've been there, and to gain a bit more of an understanding of what's really happening in the countries that are affected, rather than what sometimes being reported to us in the newspapers and in the television news. And sometimes there has been a little bit of a disconnect between what we're seeing in the country and what's being reported in Western countries. I think in Sierra Leone specifically, this is the country that I kind of know the best, social media is used quite frequently by the general population. I think it's increased in how much people are using it as the internet has improved and people have mobile phones. And certainly at the moment, our local staff and some of the cured patients and so forth will use WhatsApp groups to get information directly from trusted sources about transmission of disease in the country, as well as other ways, including the internet. And there's a great deal of transparency in the information being given out by the government and by district governments and the central government. One thing I would share, I guess, in terms of information sharing in these times is related to some of the things that were being propagated earlier on, certainly in the outbreak, and some of the impact that can have. There's certainly a huge, well-intentioned and accurate information given out at the time in Western countries as well as in West African countries. But I think it was also, it can sometimes be difficult to moderate the information given via social media when it's poorly informed. So I think that's also an interesting area not to control, but in some ways to moderate in some way to ensure that the information being propagated is accurate. Because obviously, I think with so many sources of information, it can be difficult for lay people to really understand what's accurate and what's not, and it can have a very big impact on, certainly in a disease such as this one that's transmitted through close contact, it can really affect the way people live their lives and can affect the transmission of disease. So I think for me, my conclusion with social media is generally very positive. I think a lot of people in those affected countries have gained a lot of excellent information about the disease and the transmission ongoing in their countries and how it's affecting their lives. And the only thing that I would add would be to say it would be nice to, in some way, to ensure that some of the information that's being propagated can be, yeah, I don't know, it can be ensured that it's accurate, I suppose.
Thank you so much to all our presenters. I want to start with a question, and this really can go to any of you. What role did you think social media played in some of the fear epidemic that we saw happening, especially from the middle of last year on? And is there any lessons we can learn from that?
Hello? Can I go?
Yeah, we hear you. Yeah.
Okay, I think in South Africa, the social media was a platform that a lot of people in the public space were not sure about the epidemic and how it would affect them, express themselves in terms of their fear, in terms of the panic. And it really took a long period for people to start to settle down. And it also shows how important it is, not just for civil society, but for government and other stakeholders, development partners, to use the social media, especially Twitter, to spread correct information and educational information so that people can have the right information. But there are other parts of Africa where social media, such as Twitter, is still growing. So it was not directly through social media such as Twitter, but mostly through Facebook. So it's important also to use Facebook to also try to explain to people about an epidemic and so on. Otherwise, the fear, the panic, the hysteria is easily expressed through such platforms. I also forgot to say that WhatsApp was also used a lot to spread the panic and everything.
Yeah, I would like to add to that, too, to say social media was very important. In particular, texting was a way in which to warn family members who were traveling to villages that there was an epidemic in their, or an outbreak in their community. I think it was very important. And also the humanitarian response was particularly important, too, because text messaging throughout Africa can be pretty expensive, and some of the phone telecommunications companies changed some of their rate structures to facilitate more text messages so that there could be better communication. And I think that Facebook and texting were important in this outbreak in terms of communicating, because originally there were some messages that Ebola was not real, and we saw some early campaign messages that said Ebola is real. And then after that, and an acceptance and trust in communities across different areas, that there was also a second wave of communication about the basic facts of Ebola, such as the way in which Ebola was transmitted and the need for safe burial practices. So I think we learned a lot about the importance of social media in spreading the word and combating fear.
Great. Dr. Archer, do you have anything to add to that, or can we move on to the next question?
No, I'm happy for you to move on. That's fine. Thanks.
Okay, great. So, with that said, something that you mentioned, Dr. Archer, and something that that Margaret just mentioned as well, is in terms of the accuracy of information. And you mentioned need to propagate those accurate sources. And as we know, with digital technology, social media, inaccurate information can get spread very quickly. So, with this panel, we kind of talked about how social media has been helpful in driving the conversation with Ebola forward. But, in terms of challenges, can you speak to, what are some things that we as health communicators can look out for when we're trying to spread the message about something, a public health crisis such as Ebola?
I think that's a really good question. Unfortunately, I think in general, certainly from my experience in the UK, bad news travels faster than good news. And I think that's true in social media, and I think that's true in the general media. So people want to see stories that are a little bit alarmist, or yeah. So I think that issue can spread within social media just as it does in newspapers and the TV. I think it's also important to recognise that at the moment in Guinea, for example, there are still issues around health promotion messaging, and there are still attacks on healthcare workers performing safe burial practices. So I think that there is still a significant role for social media and health promotion within the outbreak as it is now. And for me, I haven't worked in Guinea, but I wonder whether the fact that Sierra Leone and Liberia are predominantly English-speaking, and that Guinea is a predominantly French-speaking country, whether that's had an impact in terms of the kind of the Anglophone direction of most of these websites in general, and the vast numbers of people that participate in English, and maybe not so many in French. Yeah.
Jay, I have another question for you. How you spend a lot of time on the field, a significant amount. How do you balance the emotional part of a health crisis like this and being in the midst of it with your role as a communicator and with, for example, tweeting? How do you balance that? How do you bring that into each other?
I think that's very difficult. I think it's for most of us that have worked in this outbreak, it's taken a real emotional toll. I think it's been, many of us have worked in lots of different contexts and seen people who are very sick, but I think this one has been really difficult. From my point of view, my organisation values communication and thinks that it's an important role that we play because we're often an organisation that works in places that other people don't. And through communicating problems to other organisations and other people and other civil societies, we think we can, we feel that's part of our role to engage people into helping populations in need. I think for Ebola, we were pushed into a bit of a corner because there weren't, certainly at some stages in the outbreak, there weren't many other organisations coming to help, and so communication on its own wasn't helpful in bringing other actors. But equally, I think on its own, there's a role for advocating for the people we're trying to help, to say this is an issue that the world needs to look at, and not to just put away somewhere in a corner and ignore. So I think, in general, our organisation takes our communications role very seriously. And as an individual, if I can help by spending 5 or 10 minutes tweeting, I think that's not too much to ask.
Yeah, I want to just say that having good spokespersons is very important, and Doctors Without Borders did an excellent job last summer in highlighting and calling attention to agencies around the world about this epidemic and how we needed to work together as a global community to respond to it. And so I think that's very important. And in your previous question, you also talked about trust. I think that what we saw with Dr. Chen's response last summer and her passionate perspectives about the Ebola outbreak were important in getting cooperation from global agencies on the Ebola outbreak. It's interesting to know that in the United States we didn't have a Surgeon General, and I worked on AIDS for a long time, and we had a Dr. Koop, a Surgeon General in the United States, was very important in terms of taking care of fear and responding compassionately to people who had been affected by HIV/AIDS. I don't think we saw a similar spokesperson in the United States that was as passionate as Dr. Chen was in addressing the need for appropriate response. And I think it also calls, on the local level, it talks about, we should be talking about trust and having a trusted spokesperson from communities, because building trust takes some time, and there are trusted spokespeople in different communities, and if we learned anything from the AIDS epidemic, is having things that are culturally appropriate in our responses is important, and that includes linguistic responses as well.
Great. So we're now going to turn it over to Scott and Osita over in our audience room to see if there are any questions from the audience and from Twitter.
You guys have any questions? Please speak.
Yes, I have a question for any of the panelists. From a U.S. consumer perspective, it seemed that when Ebola broke out and then we saw cases here, it was all over both new and traditional media, and then the conversation just kind of seemed to stop. So why is that, and what are organizations that you're involved with doing to continue the conversation to make sure that we're getting accurate information?
Maybe Margaret, you go first, sorry.
Well, I'll just say, domestically in the United States, CDC, the Centers for Disease Control and Prevention, has quite a lot of information on the website, and I would encourage folks to go to the CDC Ebola website, because there's an enormous amount of information, including a lot of information for emergency responders. There's a list of hospitals who can now accept Ebola patients. It's over 50 hospitals, where back last summer we only had a couple. And so there's been an enormous response here in the United States from the CDC and other organizations. And Doctors Without Borders has had a remarkable effort to ensure that there's an appropriate and correct information as well, and to really stop fear.
Jay, you want to add to that?
Yeah, sure. So from my side, I think, I mean, my life has been totally consumed by Ebola for the past 6 months. So all I seem to talk about is Ebola. But no, I can see from a consumer point of view in the US that there's going to be peaks and troughs about information in other countries. I mean, there's going to be competing interests in your media from things happening in the US and from other countries. I think from our organization's point of view, we tend to speak out when we think there's a need to speak out, when we think that it's important for us to say something, either to catalyze change and to encourage others to come and do something, or, as I said earlier, to raise a flag to say something here, we need to fix this, and people need to know about it. So from that point of view, certainly in the UK, there's still a huge amount of media coverage for Ebola responses, and that's partly related to the UK sending health staff and an interest from UK consumers to know that some of the health staff from the UK have gone over there. So I can't comment exactly about the US media coverage, but in the UK it's still fairly prominent.
Yeah, I just want to add one thing too in terms of consumer. It's the relative risk in risk communication. There's a lot of science about risk communication, but the relative risk of contracting Ebola in the United States is relatively low, and yet we've seen other diseases like the measles outbreak that we've seen recently in the U.S. is not really perceived as a risk by many individuals, except by recent media coverage. And we had over 650 cases just last year of measles, and there's a very effective vaccination that is available to prevent measles. And so the risk of measles in the United States is much greater than the risk of contracting Ebola in the United States, but yet, and even neglected tropical diseases in the United States. There are millions of those in the United States, particularly in the southeastern United States, and you don't hear about that in the media. So I think that this whole issue of risk and people's understanding of risk, we're learning about that in the United States from a consumer standpoint.
We have a question about making communication culturally appropriate. I think Dr. Scarlett, you mentioned that earlier. Any tips on how to do that? How to make this type of communication, especially on social media, more culturally appropriate?
Well, language is very important, but also having individuals review the messages. I know that we learned a lot in the AIDS epidemic because I worked in AIDS, HIV/AIDS at CDC for quite a long time, both domestically and internationally. One of the things that we learned is that sometimes we didn't know exactly the right words, or as scientists we use words that might not be understood by individuals in the community. So, of course, testing those messages is particularly important, and also using the right words as well as the right language is important. I know from the Surgeon General's report on AIDS, it was translated into over 20 languages, and that was important in the United States in terms of getting the messages out about HIV/AIDS and ensuring that the material was presented in a way that was culturally appropriate. And one of the things that we learned was also that we needed to back translate these different publications, so that not only did they need to get translated, but we needed to check it and back translate it and run it by individuals from those communities so that we could ensure we were communicating the correct messages and clearly.
That's great. Sorry, did you want to say something, Dr. Achar?
Yeah, please.
Yes, sure.
So I think the major way that we get around this problem is that we actually, our national staff do most of this sort of work for us. We have a great resource in virtually all our projects all over the world that we employ national staff, and part of the health promotion aspect is we use a lot of national staff. So the messages often come from them. We support them, we educate them along the right guidelines. But it also means that when projects close down and when international organisations move on, there's been some training of and some improvement in many ways in local resources. So I think for us, we get around the problem of appropriate messaging and culturally appropriate messaging through the use of our national staff.
Daniel, I just wanted to include you in that in terms of from your experiences in Africa. You know, how can we, from us folks here in the United States, help you and your organization out, and you know, what lessons can we learn from your end to make us better in terms of getting the message out about what we can do to help? Daniel, can you hear us? Oh, sorry. There you go.
I think I lost your audio at the end.
Sorry, we just wanted to get your perspective over in South Africa in terms of, you know, what are some lessons learned from your experience, and how can we who want to help, you know, from the States and from the UK and from CDC, from VCU, you know, what role can we do to help make materials more culturally sensitive to you guys and to help out with communication in that regard?
Okay. I think the biggest challenge we have is new language, especially scientific language or medical language, because it comes from researchers, some in the United States, some language in Africa is not as scientific. So the issue is about engaging and training, especially civil society, in terms of the new language and then civil society then agrees to try to bring it closer to the people on the ground, because most people in civil society are not scientific enough, but they are able to relate to the communities with the public easier. So once they understand a concept, a scientific concept, they unpack it into a street language. So there is need for increased collaboration in a civil society. We are very happy that we now have a platform. So it means in the future it's possible for people to send materials to us, to share, and new information to us, new words to us, and we can start to agree on some terms. Because the other issue is also about translation. Because languages, Africa is a lot of languages. Unfortunately, compared to Europe and America, just one country in Africa has more languages than America and Europe put together, because Africa is very multilingual. So it's also about identifying which are the key languages, and then start to make sure that you don't do religious and traditional issues. So it's all about working together in collaboration.
Yeah, I just want to add to this one piece about the importance of religious organizations. This is a very, very important issue, and something that is important because religious leaders impart trust in the community. They are trusted leaders, and the messages that they provide are important. And so the fact that they can get the right information to disseminate it is also a critical issue.
We just wanted to bring it back one more time to our audience room over at VCU to Scott and Osita, just to see if there are any more questions from the audience before we kind of wrap things up.
I think we're good.
Great. Okay, so with that said, do you want to do one more question? Or? Okay, go ahead.
We have had a question come in on Twitter. Does the Ebola outbreak give us an opportunity to recapture widespread importance and acceptance of vaccines?
Sorry, I'm not sure I heard the question.
Let me say it again. It's a question from Twitter. Does the Ebola outbreak give us an opportunity to recapture widespread importance and acceptance of vaccines? In other words, does dealing with Ebola give us an opportunity to get vaccines more in the spotlight and more widely accepted?
Yes. Yes, it does. In Africa, we are always on the side of reacting than on the prevention side. So immunization, vaccination is a key issue in Africa. And at African Union level, they are now talking about setting up their own Center for Disease Control of some sort. That was one of the resolutions at the end of January in Addis Ababa. And as civil society, we believe that it's easier to make an awareness campaign for people to push for a vaccine for Ebola than to push for an awareness campaign to react to an outbreak, to an epidemic. And it's cheaper, in my own view. So I think it's an opportunity that we should use as civil society to push for research around the vaccine, and also to ensure that in the future vaccines are very, very normal in the response to Ebola or other similar epidemics. We have already seen the success with regards to other illnesses or sicknesses or diseases. I think malaria, also the other one I think is measles and so on, polio. There is vaccination in Africa and it has been successfully rolled out. So there is no reason why we shouldn't focus on investing in that area for Ebola.
I really appreciate your comments right now.
Dr. Scarlett, you're muted, I think.
Is this unmuted?
Yeah, you're good.
I think what Daniel has brought up is very, very important. We've seen that some individuals because of Ebola, have not been going to healthcare facilities to get routine vaccinations. And many of us are very worried and concerned about a resurgence of polio because people may avoid vaccinations. And so I think it's very important as health professionals and trusted community members that we continue to emphasize the importance of vaccinations. And also, while there's no vaccination or treatment for Ebola right now, there's a tremendous collaborative effort by international governments to really work hard together on vaccine issues. There's at least a couple candidates who are now ready for trials in Africa with cooperation by the governments of Liberia and Sierra Leone, and that's very important, and it's happened in record time. So I think in terms of response, there has been an extraordinary response to getting and testing vaccinations, but it also highlights the need for not to forget about those other diseases for which there's vaccinations like measles, like polio, and to really emphasize the importance of getting those. And that's a key communication message.
Great. Thank you so much. So at this point, we're going to end this panel. I just want to thank you on behalf of Jeanine and I and the rest of the crew here over at the Center for Immediate Health, to all of our panelists. Thank you so much, whether those of us abroad or those here, for joining us for this panel. At this time, we're going to have lunch, but tune in at 12:50. We're going to have a student panel where students from Dr. Messner's Global Social Media and Health class are going to do some presentations, and we're going to have our next panel presentation at 1:30 on the uses and influences of social media in health crisis communication. So thanks so much, and see you in a little bit.
Thanks, everyone.